Cortical sensations. The function of the sensory cortex is accurate localization of stimuli and assessment of shape, weight, size, and texture of objects. The somatosensory cortex receives tactile information, including sensations such as touch, pressure, temperature, and pain. This sensory information is carried to the spinal cord, brainstem, and thalamus. This information is then projected to the somatosensory cortex, which in turn processes the sensory information. Tactile localization is the ability of the patient to localize accurately the point touched with a head of a pin when the eyes are closed. The patient is asked to indicate the point touched with his own fingers. Two-point discrimination is the ability to distinguish the contact of two separate points applied simultaneously to the skin. If two-point discrimination is lost in the presence of intact posterior column sensations, it indicates a parietal lobe lesion. It is impaired in posterior column medial lemniscus pathway lesions. Stereognosis is the ability to recognize an object from the feel of its shape and size. With closed eyes, the patient is asked to recognize an object placed in his hand. The object must be familiar to the patient. Stereognosis is associated with parietal lobe lesions and dorsal column tract lesions. It is also seen in Alzheimer's disease. Identification of textures is a type of stereognosis. It is tested using a piece of paper, cloth, wood, or metal placed in the hand of the patient, who is then asked to identify the nature of the substance. It is impaired in all conditions of astereognosis. Graphesthesia is the ability to recognize letters or numbers written on the skin with a blunt object. It is tested by tracing out letters or numbers such as 8, 5, and 4 on the patient's palm while his eyes are closed, and asking the patient to identify the number 6, 9, and 3 are used as finer tests. Graphesthesia may be impaired in lesions in the brainstem, spinal cord, thalamus, or sensory cortex. Tactile extinction or perception rivalry is seen in contralateral parietal lobe lesions. Tactile extinction is the failure to perceive or report tactile stimulation on the body side, contralateral to a brain lesion, when the homologous, ipsilesional region is stimulated simultaneously. No defect in tactile perception occurs with unilateral stimulation. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED, the easiest and fastest way to take advanced clinical history.